Good evening, everyone. The Maine CDC and the Statewide Cancer Coalition in Maine, Maine's Impact Cancer Network, have partnered with the Maine Dental Hygienists Association and the Maine Medical Association Center for Quality Improvement to provide the webinar this evening. My name is Becky Pierce with the Maine CDC Comprehensive Cancer Control Program, and we're excited to welcome almost 180 of you to tonight's webinar entitled Human Papillomavirus, or HPV, and Oral Health Care Providers. You are the key to cancer prevention. We are delighted that so many of you have chosen to spend the next 2 hours with us and are overwhelmed, in a good way, by your response. We see this as a commitment by the oral health community in Maine to partner with us in lowering the incidence of HPV-related cancers. We have brought together two great speakers this evening to talk about HPV and the importance of promoting the HPV vaccine for cancer prevention. Our first speaker is Jessica Reed. She is the Clinical Quality Manager with the Maine Medical Association Center for Quality Improvement and has been a board-certified gerontological nurse practitioner since 1995. Over the past 8 years, Jessica has designed, implemented, and supported multiple quality improvement projects to improve the quality of care and health outcomes for people across the state of Maine. She has been the project and clinical lead for multiple HPV vaccination-focused projects, including the HPV Vaccination Learning Collaborative and the Maine HPV Project ECHO, working to increase HPV vaccination rates within pediatric and primary care practices in Maine. Our second speaker, Jamie Brooks, is currently a Master of Dental Hygiene graduate student at the Forsyth School of Dental Hygiene and is serving a second term as the Vice President of the Maine Dental Hygienists Association. She is an active member of state, national, and international dental organizations and involved in several oral health programs aimed to educate and improve access to oral health care in Maine. In the past few years, she has become a HPV vaccination champion for the dental world by talking with her patients and parents of patients about the HPV vaccine and sharing her experiences with her colleagues. This webinar will be recorded. If you're interested in watching it again or would like to share with colleagues, the recording will be sent to all who registered in the next couple of weeks. The recording will also be placed on Maine's Impact Cancer Network's website and the Maine Dental Hygienists Association website, as well as shared with other partners and stakeholders. I will now begin the recording and turn the webinar over to our first speaker, Jessica Reed.
Thank you so much, Becky, for that wonderful introduction. Hello, everyone. As Becky had mentioned, my name is Jessica Reed. I'm the Clinical Quality Manager for the Maine Medical Association Center for Quality Improvement. I am so excited to be here with you all tonight and appreciate you all sharing the gift of your time with us tonight as well. I'm going to start us off with the You Are the Key to HPV Cancer Prevention slide deck, and then Jamie Brooks is going to join us with her. We're going to have a short break, and then Jamie is going to join us with her slides. And then Jamie and I are going to co-present together and answer different questions that you may be asked from patients and families so that you feel very comfortable talking about and promoting the HPV vaccine. So again, this is You Are the Key to HPV Cancer Prevention. So just a quick disclosure, we have no financial disclosures or conflicts of interest to disclose, and that's for Jamie or myself. Additional slides have been added to the slide deck. Just want to disclose that. We put in some of our own slides. Becky did a fabulous job of creating some slides around Maine data to make it relevant and updating some just with more recent data. There's going to be some specific dental information with Jamie Brooks and her slides. And I have put in a slide about the American Cancer Society guidelines. And we also at the very end, we're going to have some resource slides as well. So for today, objectives: describe why HPV vaccine is important for cancer prevention. We're going to identify the appropriate HPV vaccination schedule based on a patient's age. We're going to talk about HPV vaccination recommendations for 11 to 12, as well as 13, and I'm also going to add in here 9 and 10. We're going to develop self-efficacy so that you all feel comfortable talking to your patients and your families about HPV vaccination. And we're going to hopefully so that you walk away today feeling really confident. I always say that knowledge is power, and that you feel really confident about having these conversations about HPV vaccinations. So we're going to dive in today to the HPV, the human papillomavirus, and understanding the burden of HPV infection and disease. This is one of my favorite slides because it looks at the different disease associations. And so it really breaks down HPV. So we've got two different types. We've got the mucosal sites of infection, right? Mucosal tissue, and we've got cutaneous. So that's your hands and your feet. And and that's where you have common hand and foot warts. And there's about 80 types of these. Now, I believe there's over 150 different strands, and I read somewhere almost close to 200 recently. The ones that we're going to really talk about and focus on for today, the biggest ones really are the high risk, our oncogenic, so our cancer causing HPV strains of 16 and 18. Those are the most common. Those are responsible for cervical cancers, or anogenitalial cancers, oropharyngeal cancer, cancer precursors, so cervical dysplasias, again, like low grade and high grade cervical disease. And then on the other side, we have HPV 6 and 11. And again, this is a low risk, it's non-cancer causing, and this is what causes genital warts, laryngeal papillomas, and sometimes low-grade cervical disease as well. So again, I think that's just a nice way to kind of break it down. HPV infection. So most females and males will be infected at least one type of mucosal HPV at some point in their lives. It's really amazing. And the latest number that I read is up to 80 million. That currently there's 80 million Americans that are currently infected with HPV, and there's 14 million new infections a year in the United States. It is so common, and it's most common in people that are in their teens and 20s, and most people will never know that they've been infected. And most studies will say that, so what happens with HPV is when you have it, again, most of the time the body will clear it. And it usually clears your body just does its own antibody response like it's supposed to, and it will clear the HPV virus in usually 1 to 2 years. Typically, it will start clearing around 6 months, and some people are completely cleared by 6 months. And it's the people that for some reason their body doesn't clear it, that they hang on to the HPV virus, and that inflammation over time is what can lead to cancer, to the cervical dysplasias and other types of cancers. So we have a poll question for you. How many types of cancer are associated with the HPV virus? Okay, you'll see this. So just click on the one that you think, and we'll give that a few seconds for everybody to do this. So yes, the majority of you picked 6, and you're absolutely correct. So great job. So you, again, we're gonna get into these cancers again in a little bit, but great job. Basically, what we're looking at is the number of HPV attributed cancers. So what the big takeaway from this slide, this is one that we added just to give a more updated with the data. The slide deck that I'm presenting from is from the CDC, the United States CDC, and which is super helpful. And again, we just had updated a few slides with a little bit more recent data. So if you look at the cervical cancer site, right, we're looking at the number of HPV associated cancers, and it's around 12,000. And of those, this is the big takeaway, right? 91% of these HPV-associated cancers of the cervix are probably caused by HPV. And again, totally preventable, right, with our HPV vaccine. And then you'll see the other types of cancer, which you all got correct, right? So cervical, vaginal, vulva, penile, anal cancer, and oropharyngeal cancer. And the other big takeaway today, and another really important reason why we're even having this webinar with all of you, is the impact that you can have, each and every one of you, on these numbers. So oropharyngeal cancers. So what's interesting is you will also see that the number of oropharyngeal cancers has surpassed cervical cancer in incidence. So what we are seeing is that, again, these are typically in men, and we're going to look at some slides on that in a minute, and 70% of all oropharyngeal cancers are probably caused by HPV. So this is a similar slide. It's just a little bit different way to look at it. I'm sorry, it's a little small, but you can see really just looking at the numbers again in just a different way. So you can see cervical right at the top, and you can see oropharyngeal at the bottom. And you can see again, just that those are the big, takeaways from this. And then again, you'll see the vaginal, vulva, anal, and penile cancer as well. We're going to look real quick here at race and ethnicity in the United States. So we're going to look at, again, just all races combined. And then you can see, again, this is per 100,000. So about 13.8 people, or close to 14 people, about 11 people. And you can see it's broken down into women and into men. And then you'll see, again, the highest incidence is in white women, again, and then we have men. And again, you can see we're Black, American Indian and Alaskan Native, Asian Pacific Islander, under race, and those proportionates, and then ethnicity, non-Hispanic, and then Hispanics. We're also looking at HPV-associated oropharyngeal cancer rates by sex, race, ethnicity in the United States, 2013 to 2017. So again, looking at this, all races combined, and this is oropharyngeal cancer, remember, we were just looking at all types a second ago. So again, not surprising, right? We have white males, like we just looked at those slides, are the highest, and which translate to the ethnicity piece for non-Hispanic, the highest, and then a lower number of 4.4 per 100,000 for Hispanics. This is just a really nice slide. It's right from the CDC website, and you will all have access to this slide deck. We will send it, it'll be available for you. And so what's really interesting in the takeaway is this is what is showing on the slide is the average age for oropharyngeal cancer among men. And it also gives you penile and anal cancer, but look at that, it's amazing. So this is, the rough age is around 61, or median age, I should say. And you will see, and then lower incidence for penile cancer. So they don't really know why it is that men seem to hold on to the HPV virus in their mouth and why they have this higher incidence for oropharyngeal cancer. So now we're looking at HPV-associated cancers and age of diagnosis among women. And again, not surprising, right? You'll see cervical, and the average age is 49. And then you'll see the other averages here, the other ages here. But again, that big takeaway right now is just to look at 49 for cervical. So for HPV-associated cervical cancer rates by race, again, this is looking at all races combined, looking at white. You'll see Black women have the highest HPV-associated cervical cancer rate. And then the other, again, American Indian, Alaska Native, Asian Pacific and Islander, non-Hispanic, and Hispanic. So again, looking at, this is actually the American Cancer Society Cancer Facts and Figures 2021. And we're estimating the number of cases and deaths by sex in the US for, again, our big takeaway, right, for today, the oral cavity and the pharynx. So new cases, again, these are estimated numbers for both sexes, is about right around 54,000 people will be diagnosed this year alone with oropharyngeal and oral cavity cancers. For males, again, this relates to back what we just talked about, 38,000 for males, and females is around 15,000. Estimated deaths for both sexes is close to almost 11,000. Males is 7,620 and females is 3,230. And again, relates back to the slides that we just showed. And again, for 70% of these, remember we just talked about, are HPV attributable and are preventable by the HPV vaccine. So in the Maine 2020 annual report on cancer, so here's we're looking at now Maine numbers, and we're looking at the latest data, which is 2017. And so HPV-associated squamous cell carcinoma of the oral pharynx, total in Maine was 135, male was 108, again showing that disproportion, which we would expect, like we talked about, and females were 27. I know this is a little bit hard to read, but the big takeaway, basically what this is, it's a really, you can find this, and Becky had put this together for us based on the CDC Maine Cancer Registry data. And so looking at all the different types, the county with the highest incidence, and that's per 100,000, was Washington County. And then the rest are some very, very similar. And you can look at and again, we could spend a bunch of time looking at this, but we have a bunch more slides. But again, just that big takeaway that you can see it's where it's a little darker where the higher incidences are. So this is another slide looking at, again, HPV-associated cancers. Now we're looking at incidence by anatomic site, comparing Maine to the United States, right? So where do we kind of line up with the United States? And what's interesting is a shaded area shows that the rate is significantly higher than the US white rate. So you'll see that for squamous cell carcinoma of the oropharynx and our total number of HPV-associated cancers were significantly higher than the United States rate of 5.5 and 117 for total associated cancers. Okay, so we're going to try to play this video.
When I was 22, I tested positive for the HPV virus. My biggest fear was that it could impact my ability to have children.
HPV vaccination prevents cancer in thousands of men and women every year.
I'm so happy that today there's a vaccine that can prevent HPV-related cancers. My children are now fully protected and won't have to worry about these cancers later.
Talk with your doctor about vaccinating your children. Brought to you by the Maine Center for Disease Control and Prevention.
So that's a great video by our own Maine CDC. So I thought it would show that. And I think that's really, something, if you're really going to engage your practice in this work and really promote the HPV vaccine, again, showing these different types of videos can be extremely impactful. It puts a personal spin, right? It gives that personal story. So I always like when I'm working with practices across the state, I always think that's really important to engage them in this work. So we're going to talk a little bit now about cervical cancer and basically looking at cervical precancer in the United States. And roughly we're talking about 196,000 high-grade cervical lesions every year. Remember, this can all be prevented with HPV vaccine. Cervical cancer is the most common HPV, like we talked about this, and we just saw some slides a few minutes ago. An estimated, again, 569,000, close to almost 570,000 new cases, and 311 and a little bit over deaths worldwide in 2018. In 2016, approximately, there were almost 13,000 new cases and just a little over 4,000 deaths in the United States. And half of cervical cancers occur in women less than 50 years. Remember, we just looked at that updated slide that showed the average age for cervical cancer was 49. So truly, HPV vaccination is cancer prevention. Most people will not, again, know that they have it. Women will usually find out they have it when they have a PAP and have an HPV when they're having their PAP done. And it is able to tell the type of strain. There's currently now no HPV test for men. So truly, after all the slides that we've just talked about, really, again, this big takeaway and the messaging truly around this is HPV vaccination is cancer prevention. So we're going to talk a little bit now about the vaccine itself. So it's a recombinant L1 capsid protein, and it forms a virus-like particle. It's non-infectious, non-oncogenic, it's non-cancer causing, and it does its job. And what it does, like other vaccines, right, is it produces those higher levels of neutralizing antibody than a natural infection would. This is another one of my favorite slides because it just breaks down when the HPV vaccine first came out, it was a bivalent. So it had covered two strains, the 16 and 18, which remember one of those very first slides that we looked at together, cause, again, the majority of the HPV related cancers. And then the quadrivalent vaccine came out next, and that covered the genital warts, our other strains. And now we have the 9-valent HPV vaccine, which covers the genital warts. It also covers the 16 and 18. It also covers 5 other types, the 31, 33, 45, 52, and 58 strains. And the latest numbers are that the HPV vaccine, when you combine these numbers, it's almost 91%. So it's actually gone up since that it will cover HPV-related cancers. So we have another poll question for you all. What is the earliest age that the HPV vaccination can be administered? And you guys are rock stars again. Yes, the earliest age that the HPV vaccination can be administered is age 9. And that is really important. And I really want you to remember that as we continue through the presentation, because that has changed a little bit in the fact that not the recommendations that you can give it at 9, but and again, I'm getting a little ahead of myself, but there's the CDC recommends 11 to 12. American Cancer Society is recommending to really start those conversations and start vaccines at age 9. So we're going to talk a little bit more about that coming up. So here we go. So starting the HPV vaccination at 9 years of age. So these were guidelines that were updated very recently, just last year, July 2020. And the 3 key issues to take away is that the ACS adaptation emphasizes that vaccines may be routinely offered age 9 through 12. Girls and boys should get 2 doses of the HPV vaccine at ages 9 to 12 years. And we're going to get into the reasons why in just a minute, but it also endorses catch-up vaccinations for all individuals through 26, so both boys and girls. And again, while continuing to include a qualifying statement about reduced effectiveness of a vaccine at older ages. So young adults as compared to teens and preteens. And the reason for that is the younger that our adolescents are vaccinated, the better immune response they have. So the better, I call them the warriors when I always try to explain this. So, again, and you guys are all familiar with this, but again, when we give that vaccine, right, it produces, like we just talked about, that antibody response. And the younger that we give this, if we give it at age 9, the better immune response they have and the better protected they are. And then back to this, so the ACS does not endorse a recommendation for shared clinical decision-making about vaccine for adults age 27 to 45. And the reason for that is they, again, by the time you are 27 and 45, you may have already been exposed to HPV vaccine. So that's the stands for the American Cancer Society. Now we're going to talk about the United States CDC. So the CDC is still recommending that we recommend at age 11 or 12 years. Start talking early. So you can see here 9 to 10. And I was actually just on the National HPV Roundtable. It's actually having its virtual conference right now. I was actually on it earlier today, and that continues tomorrow. And they had a bunch of different speakers on there talking about, again, how do we change it up a little bit with HPV, right? How do we, when we look at how we give it and how we talk about it, and really this was the big takeaway. So not just starting early, but vaccinating early. This is something I hear a lot with practices. So, the adolescents will come in and they haven't heard anything about the HPV until that, 11 or 12-year-old well-child visit. So they're coming in. At this point, they need their school, right, mandated vaccines for DTaP and meningococcal. And now we have flu, right? And then now we have COVID vaccines. So there's a potential, right, for these adolescents to be offered 5 different vaccines all at the same time. And I can assure you that does not go over super well, right, with, adolescents who really don't like shots to begin with. And so what we're finding is that starting it earlier, giving it at 9, maybe even starting the conversation at 9, giving it at 10, again, if you're giving it 9, when they come in for their 10, you've given them their 2 doses, they're done. They've completed their series by 10, again, right when we want them to, because again, like we just talked about, they're going to have that much greater antibody response. So, again, that can translate, you can give it at 10, and then you can finish up at 11 or 12, but you really want to finish because by 13 and 14, it's actually considered late, believe it or not. So then when you get to 15 to 26, again, see the red there where it says 3 doses? That's where the doses change. So you get 2 prior to 15 and older, it's 3 doses. So again, the HPV vaccine recommendation, again, they recommend 11 to 12. Again, we just talked about starting also at 9. And then they do say that here. So it does say the vaccine series can be started at 9 years old. 2 doses of the vaccine, again, are recommended if they start before the 15th birthday, like we just talked about. And the second dose of the vaccine should be administered 6 to 12 months after the first dose. And the reason for that is, again, we need to give the body to really ramp up that immune response. And we don't want to give it too early. We want to give the body, that chance to rev it up. And then we're going to give that second shot and really continue that active immune response. So again, catching up or late on vaccination. So vaccination for everyone through age 26 if you're not previously adequately vaccinated. Vaccination is not recommended for everyone older than 26 years. However, there are some adults aged 27 through 45 that may decide to get the HPV vaccine. And basically what they're suggesting and the ACIP is recommending is that that's based on a discussion with their clinician if they were not adequately vaccinated when they were younger. And again, because a lot of people in this age range, it provides less benefit because more have already been exposed to HPV. And the way obviously this works the best is if we've had this prior to exposure, which is why we're giving it to the children at a younger age. The dosing series, so again, before the 15th birthday, the 2 doses. And again, it's 0 is that first dose, and then you'd be given 6 to 12 months after that. And it's really important that there's at least 5 months in between. Most practices usually will do, I don't really ever see anybody 5 months. Everybody pretty much follows the 6 month, and typically they'll get it their first, right? Their first, maybe like, again, 9 or 10, and then get it their next well-child check. Starting the vaccine after the 15th birthday, like we talked about, it's 3 doses, and the schedule is 0, that first dose. The second dose is given in the next 1 to 2 months, and then 6 months after that. And again, that minimal dose says here is 5 months, but again, in clinical practice, it's at least 6 months. This they do follow with the 0 to 2 and then 6 month schedule. So this just talks a little bit about, just again, I'm not going to get into the details on this, but just to know again, it's intramuscular, it's an IM injection. So if a patient asked you, you would know that it goes, typically we try to give it right in that deltoid muscle, right in the upper arm. And obviously we always follow aseptic technique and use a needle and administer at the same time that we're doing other adolescent vaccines is when we also tend to talk about this as well. This talks about, again, when we talk about how to store it, and again, just some basic things. We cannot freeze the vaccine, just a little tidbit there. So now we're going to talk a little bit about HPV vaccine safety. And we're going to get into a little bit more conversation about that. If a parent asks you about that, we're going to give you some resources. So what's really important is the United States, we have a very robust vaccine safety system, right? We've got the VAERS, they call it, which is the Vaccine Adverse Event Reporting System. It's the CDC and the FDA. We've got the Vaccine Safety Data Link, and we've got the Clinical Immunization Safety Assessment Project. And then obviously post-licensure, every time, something is licensed, there's still monitoring, right? So that's called the Post-Licensure Rapid Immunization Safety Monitoring Program. And it's the FDA and 6 other partner organizations. So you can see there's some really big organizations that are continually monitoring the safety of the HPV vaccine. So what we know right now, HPV vaccines are safe. The reactions that you may see, again, if you get asked about this, sometimes there's a little pain or redness where the shot was given. Sometimes I've had practices tell me that with each shot, it might be a little more red or a little more tender at the next shot than the first one. You should not give an HPV vaccine to anyone who's had a previous allergic reaction to the HPV vaccine or who has an allergy to yeast. Brief fainting spells, syncope, and related symptoms such as jerky movements can happen after any injection. Again, any injection, including the HPV vaccine. And there's been studies that show that adolescents are predisposed due to anxiety about shots to having brief fainting spells. So to help with that, a lot of practices will have the patient be seated or lying down during vaccination, and they'll have them stay that way for about 15 minutes. So again, looking at these different reports, the VAERS reports, again, they look at if there's a serious report, including deaths, again, comparing these in clinical review, and none of this has been shown with HPV. There's the vaccine, again, the data link piece, again, the PRISM piece, and then the manufacturer post-marketing commitments, looking at, again, ongoing safety profile of the HPV vaccine. So right now, the HPV vaccine safety studies have been very reassuring, right? It has a really good safety profile. Like we just talked about, the CDC and FDA continue to monitor and evaluate them along with all other vaccines. And all of you can reassure patients who have any concerns that the HPV vaccination is safe. This is a fairly new piece that is on this. And again, we're going to give you these slides. This is all the links are at the bottom. And this, if you really want to take kind of a deep dive into the safety piece and really feel like you want to really dive into looking at clinical trials and things like that, this is the place to go. So it's developed specifically for clinicians and health professionals to go and take that deep dive into the safety piece. So I would highly recommend that you check that out. So now we're going to talk a little bit about outcomes and the impact that we're already seeing across the world, really, with the HPV vaccine. And so when we talk early outcomes, we're talking years, okay? So we're going to go early, mid, and late outcomes. And to kind of think of that in your mind, think of, again, early outcomes are in the years, mid outcomes are years to decades, and late outcome is decades, okay? So our early outcomes would be our HPV prevalence and our genital warts. The mid outcomes we'll be looking at, right, our cervical dysplasias and precancers. And then the late outcomes are the HPV associated cancers. Now keep in mind that the vaccine's only been available since 2006. So when we look at the vaccine and look at impact monitoring, so we look again to look at the real world effects and effectiveness of vaccines. And we want to look at population health, population impact. And so again, where we are with the vaccine, we're looking at early and mid outcomes. And we've been reporting this, and again, looking in a bunch of different countries, right? So we're showing that the HPV vaccine is having impact, again, population level impact in HPV prevalence in other countries such as Australia, Norway, Denmark, Sweden, Switzerland, the UK, and us. Genital warts, again, similar, Australia, Belgium, New Zealand, Denmark, Sweden, Germany, Quebec, and the United States, and cervical lesions in Australia, British Columbia, Denmark, Scotland, Sweden, and the US. What kind of impact are we seeing in the United States? So we are seeing declines in the vaccine type prevalence. So again, we talked about those different strains that the vaccine covers, those 9 strains of HPV. Specifically, right, remember that 16 and 18 are the big ones that we want to remember. And then those 5 other types that cause, again, the majority of the HPV vaccine, HPV-associated cancers. Declines observed in, again, that vaccine type prevalence, like I just mentioned, genital warts, and then the cervical precancers. So this is looking at the early vaccine era compared to the pre-vaccine era. So if you look at the top here, you'll see there's a gray and it says pre-vaccine era. So from 2003 to 2006, before HPV vaccination was launched, we're looking at 14 to 19-year-olds. And then we're looking at early vaccine era of 2007 to 2010. And the incidence, right, of HPV, the prevalence, there was a 56% decrease just in that short time span. And what's interesting, right, and this goes back to the immune response piece that we talked about, there's not really a lot of change, right, in the 20 to 24-year-olds. Well, it just started, right, so we wouldn't expect to see necessarily that impact as of yet. The next slide will show us that as well. So now, right, that we've had a little more time with HPV vaccine, you'll see again that pre-vaccine era, okay, that 11, you'll see again that decrease that we just talked about. And now we're talking later vaccine era. So now we're seeing the impact from 2013 to 2016 and an amazing 86% decrease in the prevalence, right, of HPV. And again, looking at 20 to 24, now you can see that impact, right? 71% decrease. And then again, you'll see a little bit of addition here in 25 to 29 and 30 to 34, but nothing necessarily statistically significant. So again, it speaks to getting that HPV vaccine younger to have a better immune response. So this is looking at 14 to 19-year-old females. And again, we're looking at 2013 to 2016 compared to pre-vaccine era. And again, we're looking at now non-Hispanic white, 86% decline in prevalence. We're looking at non-Hispanic Black had a 74% decrease in prevalence, and Mexican American had an 87% decrease in prevalence. And combined, the average is about 86%. So incredible impact from the HPV vaccine. Speaking of impact, this was called the HPV Impact Project, and this is 2008 to 2015. And again, this is looking at, again, we're talking about cervical precancer. We're talking about incidence rates per 100,000, okay? And what we're showing, as you can see, significant declines in these cervical precancer incidence rates. And you can see, again, the impact that the HPV vaccine is making. This is a really interesting slide because it's showing you on the left, females, right? And then on the right, you'll see males. So Australia began, and they actually mandate HPV for school. So they started in 2007. And when they started in 2007, it was only given to females. But what's really interesting is if you look over on the male side at 2007, you will see a significant decline in HPV genital warts, right, by first visit, even though they didn't get the vaccine. So it's showing you the impact that by vaccinating, right, this majority, you're protecting another population, which we call herd effect. So, again, the people that have the HPV vaccine are not they're not sharing the HPV vaccine the HPV virus with others. So I just find this slide really amazing that, again, to see that kind of decline in having genital warts at first visit when they haven't even gotten the vaccine. So big takeaway. So again, we talked a little bit about this, but again, this is looking at population level impact. Again, this was 65 studies in 14 different high-income countries. And after 5 to 8 years of vaccination, incredible data among 13 to 19-year-old girls, HPV, again, that 16 to 18 we talked about, decreased by 83%. And we can't forget genital warts, decreasing by 67. 20 to 24, again, less, right? We talked about with that immune response, decreased by 66. Genital warts decreased by 54. And among 20 to 24-year-old women screened for a cervical cancer, the cervical precancers decreased by 31%. And again, we're seeing this evidence of the herd effects again among boys and men in countries that are not part of the vaccination program. So these countries are not vaccinating boys with HPV, but we're seeing this evidence of herd effects. So right now, the study suggests that the vaccine protection is long lasting. And again, this side's a little bit older. We have now data for 15 years. And so when your patients ask you, again, right now, there's no evidence that they need a booster. Right now, there's showing that there's no waning protection from the HPV vaccine. Again, it's safe, recapping, it works, and the protection lasts. So now we're going to get into framing the conversation a little bit about the HPV vaccine. And Jamie and I are going to get into that in detail in the second half of this webinar. But again, just looking at a few more slides, just again, this impact that when you look at this one, the red and the blue are your DTaP and meningococcal. And the next slide is our HPV. So in looking at that, again, this orange line should be up where the red and the blue is, right? So if we're giving the HPV vaccination when they're coming in for their other adolescent vaccines, we should be able to have those same high numbers that we have with DTaP and meningococcal vaccine. This is looking at missed opportunities. So when we say missed opportunity in clinical practice, we're talking about when they come in for a visit and for whatever reason, in this case, we're talking about HPV, they did not get the HPV vaccine. So if you're looking at this and looking at this, whether it says HPV1, all adolescents, so combining boys and girls. So if the HPV vaccine was given at the time that another adolescent vaccine was given, instead of being at 64% vaccinated, we would be at 94% vaccinated. Same thing here, which translates to boys. So again, if the boys were given the HPV vaccine when they got another adolescent vaccine, again, it would be 93% vaccinated. And for girls, it would be 95% vaccinated. Again, giving that at the same time they're getting their other adolescent vaccines. So we can do better, right? We can do better. And that's where we all work together. This is looking at rurality and looking at urban and the disparity, looking at an urban coverage of 71.9% in getting one or more HPV doses. And you can see the rural area was much less at 59.5% vaccinated to get one or more HPV doses over the 2013 to 2018 time period. But what is interesting is that they both have gone up pretty much the same proportion. So it is good that rural percentage is increasing because we definitely want to see that. So again, that translates, as we know, to a lot of Maine. We're a very rural state. And so again, we need to really think about, talking about the HPV vaccination in clinical practice. Again, every time a patient comes to see you, that's an opportunity for you to talk to them about the HPV vaccine. Again, you're examining their mouth. Jamie's going to get into this a little bit more, but that's a prime opportunity to be able to talk about HPV as you're screening for different oropharyngeal cancers. So fewer parents in rural areas report receiving a recommendation for the HPV vaccine from their provider, which is really interesting. So urban areas reported 77% of the parents said they had a recommendation from their provider. In the rural areas, 70% said they had a recommendation from their provider. So looking at reporting a recommendation. So yes, they got a recommendation. So 78% got the recommendation. So of those 78%, 75% got a vaccine if it was recommended to them. 25% did not. And this is the other interesting piece. So those that did not get a vaccine, those that did not get a recommendation, 47% of them got the vaccine, but 53% did not. So truly showing the impact that we can all make by recommending the HPV vaccine. They trust us, they trust you. And so again, this is just really where we can make that impact and prevent these HPV-associated cancers. This slide talks about the parents gave reasons why they have not started the HPV vaccine series. You may hear that they're not sexually active. We're going to talk about we're going to talk about all of these actually, that it was maybe not recommended to them. They may have some safety concerns. We just went over all of that together. They maybe feel it's not needed or necessary, and this lack of knowledge, right? So that's where we need to move the bar as well, right? That lack of knowledge. So this is talking about the value that parents place on vaccines. And what's interesting is that the parents, right, that were surveyed for this had the same value of the HPV vaccine as they did with other adolescent vaccines. You know, they really felt that it was just as important. This talks about now what they did is they asked clinicians to estimate what they felt the parents' value that they put on HPV vaccine. And what was really interesting is that they perceived that the parents had a lower perception of value of the HPV vaccine than they actually did. So again, the perceived and real concerns of parents influence how clinicians recommend the HPV vaccine. So what's an effective recommendation? So we're going to get into this a little bit, but really, you know, it's to be confident, right? And we want to treat the HPV vaccine just like we would any other vaccine, right? We want to, you know, when we talk about it in clinical practice, a lot of times we're bundling with other vaccines. And when we do, there's actually research that shows that you want to put it in the middle. So again, you want to normalize it. And that's where you folks can come into, right? As your client is sitting in the chair and your patient and you're talking to them. And again, you know, Jamie's going to get into this a little bit and how she does this, but it's really to have a conversation and take the time to really find out what that concern is, right? So if the parent says, no, not really, you know, we haven't had that yet. And, you know, I just don't feel really comfortable about it, right? That's a great opportunity to just say, well, you know, is there something specific that you can think of that's keeping you from having your child vaccinated? And again, we're going to talk about what they may ask or say, and we're going to do that in a little bit. But again, to really take that time to find out what that is incredibly effective, right? So the effective recommendation is to be confident, treat it like you would any other vaccine, you know, that they're getting. And you can say, look, you know, when they go in to for their school vaccines, you know, they can get the HPV at the same time. You know, now getting the HPV vaccine at the same time as meningococcal and DTaP does not increase the effectiveness of HPV vaccine. But again, it's just an important piece to know that you want to bundle them together. And again, we want to normalize this, right? It's just another vaccine that they need to get that prevents cancer. Really important. So here's where you all come in, right? So the role, again, that you all have as dental professionals around HPV and HPV vaccination. And I really see this. I've been doing this work in HPV for about 8 years now. Time flies, right? For all of us. And I really think this is where we can turn the tide a lot. And I think that you all have a huge role as educators for patients, families, and the community, right? About HPV vaccination as cancer prevention. Again, we talked about making the strong, presumptive recommendation, again, starting at 9, right? I want to remember that takeaway. And, you know, having education materials, we're going to give you some resources and things at the end of this. The HPV vaccination roundtable has an action guide that's specific just for you folks. It's just for dental professionals. So we're going to send that out to all of you. Even taking, I mean, I can put the link in the slide, but again, realistically, I know that if it's sent to me and it's right in my email and I can open it and open the link, then I'm going to probably do that. So again, rather than putting it in the slide deck, we're going to be sending you some things as well. So, you know, again, providing that, you know, the education at your practices, resources, addressing any, you know, concerns that parents may have about the HPV vaccine, and keeping them around. So what you can do too is there's some great, on the CDC website, they have posters that are 8.5 by 11. They're perfect. I have practices that will buy like they're just a clear, you know, sheath so that you can clean it, right? Very important nowadays. And so, you know, that can be aseptically, you know, cleaned, and it's on the back of the door, so it looks nice, right? It's not a piece of paper that's like flying around. I know sometimes, you know, it depends on how your practices are set up. It may be kind of an open concept or things like that, but there's still always places to have information for them while they're waiting. I always say that the waiting room is an opportunity to educate, right? Even if they're there for 5 minutes while they wait for you, while you're finishing up with another patient, that's an opportunity to educate. It's a perfect time.
So this is how the collaboration began. In 2019, there was a mailing sent out from Maine CDC cancer programs to all registered dental hygienists in Maine. And after that mailing went out, I got an email from Jamie Brooks wanting some more information. And as we talked and discussed things, those conversations eventually turned into this webinar, which we're sharing with all of you. And if you're looking at the screen, you might remember some of these pieces that some of you got a couple of years ago. So The dental community can play a huge part in helping to prevent cancer. And to make this point, we're going to play this 4-minute YouTube video from the Washington Academy of General Dentistry and the American Cancer Society, and they will talk about why it's so important for the dental community to help out with promoting the HPV vaccine.
My name is Eric Statler. I am a 9-year stage 4 metastatic oral cancer survivor. Head, neck, and oral cancers are historically difficult to detect. Survival rates in head and neck cancer are really low. So early detection and prevention is imperative.
Oral cancer is a particularly dangerous type of cancer because by the time it's detected, most of the time it's already metastasized. It is painless to begin with, and it comes in many forms, and that makes it very, very difficult to diagnose. Dentists see patients on a regular basis, much as 2-3 times a year. And I have a personal policy of screening each and every time I see a patient. It doesn't take that long, but it may save their life.
Well, when you're talking about screening for HPV-related head and neck cancers, your dentists are imperative. They're the most educated about the disease, and they see 83% of our population before the age of 17.
AGD's particular work on preventing oral cancers through the oral examination process that happens in a dental office, and combine that message with getting your kids vaccinated to prevent HPV-related oral cancers.
Oral cancers specifically are tobacco, alcohol, and HPV. HPV, when you look at the numbers, it's the fastest growing demographic, the fastest cause of head and neck cancers and oral cancers.
There's a commonality and a shared goal of wanting to prevent a very serious form of cancer. In this particular case, it's oral cancer caused by the HPV virus.
The message that we're trying to get out to the patients is that the vaccine exists. If I were to ask you if there was a vaccine to prevent cancer, would you be vaccinated? And I think the majority of people would say, yeah. Well, guess what? There is a vaccine against HPV-related illnesses.
Kids of the age range of 11 to 13 are in the dental chair a lot more often, in some cases, than they are in a pediatric office. So we look and view the relationships that we have with dentists as being a key strategic partner in the message and the advocacy about wanting to get kids vaccinated. And we view a strong recommendation by a dental provider as important as a recommendation from a doctor or a pediatrician to get children vaccinated.
Now, the reason why it makes sense for all of us, including dentists and doctors, to work together to promote this is we all have access to young kids in our practices. We do as otolaryngologists, dentists do, pediatricians do, primary care doctors do. So we should all be working together to push this. And if we can prevent people from suffering through the treatments and the difficulties associated with this by simply getting them vaccinated, it's well worth our efforts to work together towards this goal.
And if you can prevent pain by a vaccine, that makes sense to me. And that gives you hope. And in cancer care, hope is sometimes what gets you through.
So I am going to give the controls over to Jamie now, and she is going to continue the webinar and talk about her experiences with promoting the HPV vaccine in her world.
All right, hello everyone. What a great impactful video, and Jessica, thank you for your presentation. Such great information. I know a lot of information. But my role really is to talk about how can we take that knowledge and integrate it and apply it into our practice. So as Becky said, I am a registered dental hygienist. I have been for about 6 years now. So for my portion, let's see, our objectives are to describe the burden of HPV disease and how it relates to oral health, define the importance of HPV vaccination and oral cancer screenings, provide tools for integrating HPV prevention strategies into the operatory, as well as providing useful and compelling information about HPV vaccination to parents and or caregivers, and to locate resources for both parents and the dental practitioner. There's gonna be a lot of resources, as Jessica said, for you. So don't think that you have to recall all this information by memory. So the roles and the obligations of the dental hygienist, no one's expecting you to be an expert in the field, or you're not an epidemiologist, but we do, as these cases of oropharyngeal cancers are on the rise, it's really shifted the responsibility from primary care physicians and pediatricians to the dental professionals. So I would say our role is to screen, so oral cancer exams and identifying the risk factors for oral cancers, as well as educating our parents and our patients on what HPV is, how it affects their mouth, and the information on the importance, the safety, and the prevention properties of the vaccine. And the third one might be new, a new concept, but referring or interprofessional collaboration between dental offices and primary care physician offices and pediatricians. We'll talk a little bit more about that. And I believe the next one is a poll. So what percentage of oropharyngeal cancer may be caused by the HPV virus?
All right, I think we'll end it. Can you see the results now?
Yes, I can. 70%. Wow. And 76% of people got that right. So you guys are already experts. I don't even need to go on. Just kidding. The next slide. Okay. So human papillomavirus and oral cancers. So yep, 70% of oral and oropharyngeal cancers are said to be caused by the HPV virus. Of the 80% who will get HPV, so that's a large number, right? Most people will get it at some point in their life. 10% of those men and 3.6% of those women will have the oral HPV strain, which is strain number 16. And again, there are about 200 strains of the HPV virus, and we're primarily concerned about with 16, the Gardasil 9 will cover 9 of those strains as well. Okay, and so when I'm thinking about how I'm going to talk to a patient, I use age as a kind of a reference of how to guide my conversation. So starting with the 9 to 10-year-olds, and I really should have changed that to 8 to 10. We're preheating the parent. So we're giving them information. We're advising the parent to call and make that appointment at their pediatrician for their child if they're near 10, or to ask the child's doctor at their next checkup. The next age range is 11 to 12. And so here I'm putting a lot of effort into maximizing the parent's decision and taking advantage of this optimal window of vaccination. Sometimes we may see the patient more than they go to the pediatrician office. And so really just being that extra voice of recommendation. So 11 to 12, really crucial age. Like Jessica said, we want to get them in and vaccinated before they're exposed. The yellow, which is age ranges 13 to 18, which is not too late. They will need 3 doses if they are 15 or older. And at this age, it's important to remember that it's likely that the parent has declined the vaccination and may benefit from you having that conversation with them and bringing up HPV prevention. When somebody hears something from multiple sources, they're more likely to believe the information to be true, right? So they're getting it from their pediatrician office. They may get it from other parents, but you being another healthcare provider recommending that could be the deciding factor for them. The orange is 18 to 24. I think this is actually another great age to talk to an individual about HPV vaccination. At this age, they are an adult and they can make their own healthcare choices. If you remember what Jessica said, the timing of the shot. So if they're a college student and they're home at Thanksgiving, get your first dose, then you're home for Christmas or spring break, you get your second dose, and then over the summer, boom, there you go. They're fully vaccinated. And recently, I can't remember when the guidelines were extended for the age, but up until age 45, like Jessica said, again, this is a conversation that you have with your physician. It's not for everyone. I could be wrong, Jessica, but this is the patient that I'm thinking of. So like a 35-year-old has been married for their high school sweetheart for X amount of years. They're recently widowed or divorced, and now they might potentially have other sexual partners, and that might be, and that, is that right? What I'm thinking of?
Correct. Yep. No, that's a great example. Yes, because again, they would have this similar risk, right? Because if they've been with that same person for a long period of time, and that person did not have an exposure to HPV, exactly now that they're out into the dating world, they're going to be exposed to HPV. So, like you said, that would definitely be an individual conversation with their provider to talk through this risk and benefits. So, absolutely. But no, that's a perfect example. Great job.
Awesome. Yeah. And you may not know that personal piece of information about your patient, but if you do, then you can just casually bring it up and say, have you ever considered getting the HPV vaccination for that? And then, so on all of these colors, on all of these age ranges, I'm doing an oral cancer exam. Let's see if I can get the next slide here. So again, regardless of age, I am assessing their risk factors. Do they use tobacco, marijuana, e-cigarettes? What's their alcohol and drug use? Are they out in the sun a lot? Are they fair skin? Because you can have extra oral related cancers, poor oral hygiene, poor diet. Are they immunocompromised? Regardless of age, I'm educating the patient. I'm educating the parent or the patient on keeping their mouth healthy and disease-free. I don't need to tell you guys about that. You guys are already doing that every single day in the trenches. But also on oral and oropharyngeal cancers and HPV vaccination. Even if a parent is in the chair, I might have a conversation about whether or not their kids have been vaccinated. Of course, oral cancer exams on everyone, every visit, and then offering to refer. So getting comfortable with that interprofessional collaboration, picking up the phone and having a chat with your town's pediatrician or the nurses on their protocol for HPV vaccination, discussions, and administration. I know some of you are probably rolling your eyes. I don't have 10 minutes. I don't even have 2 minutes to go to the bathroom. So I get that. You're not always going to have time to pick up the phone. But when you do have that time, I think it can really make a difference. And it looks good for you as a clinician in your office. You're really displaying evidence-based practice there. Okay, so where is HPV cancer typically found? So primarily in the tonsils, the tonsillar crypt, and the base of the tongue. A small portion can be found at the front of the mouth. And regardless of where the research tells us are common areas for HPV-related cancer, we need to have a system in which we check all surfaces of the oral cavity. I perform my oral cancer screenings the same exact way every single time, so I don't miss something, so it minimizes error. I ask the patient if they've had a sore throat, lymph nodes, trouble swallowing, or hoarseness in their voice lately. I'm by no means a seasoned hygienist, but for patients who have been diagnosed or a survivor of oral pharyngeal cancers, if the dentist or the doctor or the hygienist, ENT didn't catch it, there's never been one patient who it started out the same way. So for example, one may have had trouble swallowing, the other had a ringing in their ears or a sore throat. And it's all these seemingly benign symptoms that you think, oh, allergies or it'll pass, but it could quite possibly be oropharyngeal cancer. And you don't want to freak the patient out, but your job is to be very, very thorough about any kind of symptoms and any visual changes that you see. And I'm going to go over this a little bit later, but I tell them I'm doing an oral cancer screening. I think that's super, super important because I've had many patients who are not my patients. I'm seeing them for whatever reason, and I go to tell them that I'm doing the oral cancer exam, and they say, I've never had that done. And I either know the hygienist who treats them, or I've seen in the notes that they've had it done before. And really telling them that you're doing an oral cancer screening is going to, one, open up the dialogue for you to segue into having that conversation about HPV related oral pharyngeal cancers. And also two, it's like an added benefit. It looks good for you too. So, and then those oral cancer screenings take less than 2 minutes to do. So super, super quick, but yet only 66% of dental hygienists report performing an oral cancer screening on a patient's initial appointment. I forgot to add the reference there, but I have the PMID if anybody would like that. So on the screen, you see, we used to think that oral cancer only occurred in older patients who smoke and drink alcohol. Now we know that 70 to 80% of oral cancer is a result of the human papillomavirus. That's from a professor at the Texas College of Dentistry. And she says, because of HPV, we are now seeing oral cancer in patients who are in their 20s and 30s who have no history of tobacco use. That really blows my mind and makes me kind of sad because this cancer is preventable by a vaccine. And I think that's why I'm so passionate about this, is because I don't want anybody to come into my office with oral pharyngeal cancer, but it's really heartbreaking when you see a 25-year-old come into your office who has oral cancer, and it could have been prevented because they could have got it in 2006 when the vaccine first came out. So only 66% of dental hygienists are doing an oral cancer exam. Like I said, less than 15% of patients that visit the dentist regularly report having an oral cancer exam on a regular basis. So basically take the 2 minutes and do the exam and tell on everyone and tell them that you're doing it. The Oral Cancer Foundation states that the fastest growing segment of oral and oropharyngeal cancer population are otherwise healthy, non-smoking individuals in the 35 to 55 age range. So when you consider both anatomical sites, the growth is in the oropharyngeal HPV positive cancers primarily. And additionally, it's good to note that if an individual has the HPV virus, which they most likely won't know if they have the virus or not, and they smoke, the smoking increases their chance by 15%. So that might be a good tool for tobacco cessation as well. Okay, so my tips and tricks, as Becky said, we did this first webinar in 2019, but for the year prior, I had done a little presentation at my place of work, and I was kind of trying out different things with patients and like keeping a Word document. And so this is probably compiled from what worked and what didn't work. So the first one is to go through your charts the day before, or some of you like probably 5 minutes before, but I go through the day before, and I'm highlighting their age if they're between 9 and 13. So that's like my hot age. I really want to spend some time talking with the parent. Hopefully their parent or caregiver comes in. Just so I know, just so I'm aware to have that conversation. And two, I document in the clinical note. So especially if 6 months ago or 4 months ago, mom said she was going to schedule an appointment for Timmy at Dr. X so-and-so's office. Or I noted that dad took a pamphlet and he was going to talk to his wife about it. So now I have that information I need to follow up from that conversation. So the next time I see that patient. And that's really, really, really important. I have brochures on my countertop. As Jessica said, the HPV Roundtable for dental providers has a lot of infographics, posters, RX pads that you can recommend as a reminder to parents and caregivers. So those subliminal messages are super, super important. A signature move. So my signature move, everyone can make their own, but you can steal mine if you want. Mine is using the medical history and I'm always like, I never want to just, for me, it's easier if I have a way to talk about these more potentially difficult conversation. So I'm using something to segue into that. And for pediatric patients, it could be the medical history. So I say, who is Timmy's pediatrician? Is it still Dr. So-and-so? If they say yes, then I say, great, Timmy's only 9, but Dr. So-and-so will most likely be talking to you more about preventing HPV through the vaccination within the next year or so, or maybe she has already. And then mom says, no, she hasn't. And I can say, well, I can tell you why I'm bringing it up today. And then that kind of like, it's an easy transition. Other strategies with adults is the oral cancer exam. So I'm stating that I'm doing it. Most patients say, oh, well, I don't smoke or I don't drink. And then I can say, well, it's a misconception that smokers and drinkers, they just get oral pharyngeal cancers. And that's how I frame that HPV conversation with adults. And then be prepared to admit when you don't know something. I'm not an expert. There's a lot I don't know on HPV, the vaccination, the etiology of it. So sometimes I'll get parents who ask some pretty hard questions, and I say, I don't know, but I'll be willing to look that information up for you and get back to you. And if I could add another trick that's worked for me too, is just being empathetic and being just being aware of parents' concerns. I know I'm not a parent myself, but I know that parents do not want their child to have cancer. So they're most likely misinformed, or they have misconceptions, or they're just, they have some fear, and really listening to their concerns and using facts to provide evidence-based care to, treat your patients and make recommendations, I think is really important. So it is good to talk about some barriers, because there's been a couple of studies that have found there's barriers among dental providers and dental hygienists when recommending the HPV vaccine. This study that you see was in 2018, the Papilloma Research Journal. So they surveyed 166 dental hygienists, and they found that over half, why they weren't recommending the HPV vaccination, why they weren't having the conversation, was because over half feared offending the patient. Over half said that they had lack of time. 20% said they didn't know enough about the HPV and related cancers, and about 1 in 5 said they didn't feel comfortable. So I definitely understand the lack of time. That's your own time management. I don't really have any, that's a whole other CE course. But the fear of offending the patient and not feeling comfortable, I think really comes down to taking away the sexual component from this. You really don't have to be a sex ed teacher. It's not your job to talk about that. This is a oral cancer that can be prevented through a vaccine. And it's really as simple as that. And when you take the opinion and the emotion out of it from your side, you're really just presenting facts and doing your job. We have a lot of uncomfortable conversations sometimes in the chair, and this just might be another one for you, but it shouldn't stop you from performing that responsibility on your patients. Another study that just came out recently, I believe October of last year, surveyed 135 hygienists. 90% agreed that they have an important role in preventing HPV-related oral pharyngeal cancers. 94 agreed that it was dental providers' responsibility to educate patients on the link between HPV and oral pharyngeal cancers, yet only 66% felt comfortable and confident talking about HPV with patients. So we know it's part of our job, and part of our role is just taking that information and applying it. So again, just to reiterate, these cancers caused by the human papillomavirus are 100% preventable by vaccine. We have a duty to prevent disease, so it makes sense that this is now our responsibility. There's such a high rise in these numbers, and I think it's been long overdue that the responsibility has shifted. So I hope that gives you some information, some knowledge to equip yourself and have those conversations. And let me see if I can give you. Control. Okay, thanks everyone.
everyone. This is the time when Jamie and I are going to have kind of an informal conversation with all of you. And we're just going to talk a little bit together about the HPV vaccine and some of the questions that you might get asked. And then we are going to go to questions from all of you. So again, if you have any questions so far, we just encourage you to put it into the chat box. And again, we'll be addressing that at the end of the presentation. So what we'd like to do now is talk a little bit about, you know what, I'm not sure if I have control. Actually, Jamie, why don't you take control of it again? Because for whatever reason, my mouse is seems to be more sensitive, and I think it'd be great if you could do that.
Okay.
Okay. Okay. Perfect. Excellent. Thank you. So I'll let you be in charge of that. All right, so we're going to talk some questions together. And so I have the clinical perspective. I'm a gerontological nurse practitioner, like Becky said. And so I think together, you know, Jamie and I really enjoyed this the last time we did it, and hopefully all of you will as well. But it's really just kind of answering questions and from both our perspectives on what we've kind of learned in practice that we have found to be effective. Because again, really one of our goals is for you all to leave this presentation really feeling knowledgeable and empowered to have those conversations like Jamie said. And Jamie, thank you, you did a great job. So, okay, why does my child need an HPV vaccine? So can you scroll to the next slide, Jamie? And again, we both kind of talked about this, you know, because it prevents cancer, right? This is why we're recommending this today. So Jamie, has anyone ever asked you that question? I guess it'd be interesting. Yeah,
definitely. And I think my follow-up question would be to kind of probe them and see why, you know, there's usually one concern that they have, like one glaring concern, right? Whether it be sexual activity or the efficacy, the safety of the vaccine. So it's kind of just getting to that root problem or that concern. And so I think that's why they're asking, you know, why does my child need it? Because I think that they have a concern underneath that question. You find that in the doctor's office as well?
Yeah, no, I was just going to say, I think, you know, a big piece of this, I think you said it really well in your presentation. And this is another big takeaway from people. And again, I just want to reiterate what Jamie said. You do not have to have the conversation. This isn't a conversation about sex. And that is truly where, when the vaccine was first, you know, released, you know, that's where this went. And so we really have truly, and I know I mentioned this on my presentation, but we really are trying to change that messaging. You know, and that has been a huge component. You know, we all know that changing clinical practice takes time. We know that. But I think at this point, truly, you know, and that's why, again, talking to them about 9 and 10, all that you have to say is that we have a vaccine that prevents cancer. Like Jamie said, that is it. That's the conversation. You know, I had a pediatrician once say to me, you know, I just tell him it's the cancer shot. I said, you need your cancer shot.
Like, I like that. Yeah.
Right? That's what he calls it. You know, he's a pediatrician. He's been doing this a long time. And he's like, this is, you know, the HPV, it's your cancer shot, you know.
Basically what it is, really.
Yeah, just a really simple way to, because truly that's what we're trying to talk about here, right? It's the conversation that you need to, again, you know, and again, if they start asking questions, obviously you can, you know, answer those questions. Mm-hmm. And you can also steer them back and say, you know, yes, you know, but honestly, I find that if you just present it as cancer and present it like that, it really takes all those other, really negates a lot of those conversations. It's really amazing.
Yes.
That's what I would highly recommend as well. So what cancers are caused by HPV infection? Now, have you ever been asked that question? Cancer? Like, do they question you? So if you say the HPV, so if you say to them, the HPV vaccine, you know, have you had, you know, has your child had that, you know, cancer? Has anybody ever said to you, what cancers does it cause? Have you ever found that happening?
Not particularly. I mean, I really focus on the oral pharyngeal part. I think that's my expertise, but I would feel comfortable if a parent asked me what other cancers are caused by it. But I really like to hit home while we're in the dental office, you know, being a hygienist, that's my primary goal.
Yeah. Awesome.
Next slide.
So again, we talked about this. So that persistent, like we talked about, right? That body doesn't clear it. That persistent HPV infection can cause cancer of the cervix, the vagina and vulva in females, and cancer of the penis in males, and cancers of the anus and the throat in both. And again, you know, we can prevent this, right, with HPV vaccinations. And again, we say in the clinical practice that we'd be starting the series today. And again, Jamie, that's probably where you would say something about, again, referring them to their primary care provider.
Yeah.
I want to talk about that a little bit too. So can you talk a little bit about that, I think, with people and kind of explain how you do that? Because I think that's really important. So when you're talking about the HPV and they say, yes, you know what, I do. I need to keep meaning to schedule that. I keep forgetting. And you're like, no problem. You know what, I could actually help you with that. Right?
Yeah.
So
and they say, what?
So maybe you could talk a little bit about that, because you had some great, like, your tips and tricks that you talked about, but I think that's a key piece too, because again, you're getting their permission, obviously, to call to call their primary care provider. So maybe you could just talk about that for a second.
So before I actually even started offering that to patients, I called my childhood pediatrician, and he's still practicing. And I called the office and I said, I introduced myself and what I do, and I just asked about their protocol. How do they frame their conversation to their patients? Do they even talk about oropharyngeal cancers, HPV related? What's their dosing schedule? Because when I really got into this, I didn't know much. I know I had the vaccination when it first came out, but I really just wanted to put some feelers out to the pediatrician office and say, kind of set up that rapport and that relationship with that office. So after I did that, and talking with patients, like you said, they're too busy, or they haven't yet, or they escaped their mind, or they couldn't go last time. There's probably no doubt more families that haven't been in since of COVID. So when they're saying an excuse why they haven't had it done, me stepping up and saying, well, I can make that phone call for you. I know Dr. So-and-so. I could have them give you a call, and to set that up, today they could probably give you a call, or I could let them know that you'll be calling them, or just, offering to help out and facilitate that process. And most of them are very receptive. We're pleasantly surprised. And I had a couple say, oh, no, I'll do it today, definitely. And then the next time I saw them, it had been done. But I think it's a really awesome thing to, as a dental provider, feeling immersed in somebody's overall health and having that ability to call the primary care office or that pediatrician and talk with them. I know I don't always have the time to do it, but I think it's a really, really important and underutilized asset and step that we can take in fighting HPV-related oropharyngeal cancers. Definitely.
Awesome. Thank you. That's perfect. Yes, that's what I would explain. And I like the fact that I love the fact that you are proactive. So you've already called the provider, right? You've called some pediatricians around you, again, and they are able to set it and you say, look, this is what I'm doing. I'm really advocating for the HPV vaccine, and you will be getting, calls from me. I just want to introduce myself. I think that's awesome. So again, I think that opens up the door, like you just said, because when you're talking to them and you're saying, okay, so I know Dr. So-and-so, I've already talked to them, I do this with other patients. Again, I think that just normalizes it yet again and normalizes your role and the work around this as well. So I think that's awesome.
Yeah. And I think that, the pediatrician office was very, they were pleasantly surprised. They were like, oh my gosh, it looks good for you as a clinician. It also looks good for your office. Like I said, the only thing is you got to take a couple minutes out of your day. And I know it's busy, but I think it's such an important thing to do.
I agree.
And
all right, actually, let's do the next one. Yep. Are they really at risk for HPV? I don't know if anybody's ever asked you that question about risk.
Yeah, they ask me, what is the risk? And so I tell them most people will get it sometime in their lifetime. And that shocks a lot of people. 80% of people are going to get it at some point. And so you're going to always have that chance that you might not clear it. So I would say 80% is a large portion of the population. So anyone's at risk if you're at any point in their life. So, and then it kind of follows into the conversation. Well, why do they need it now? And I think that's kind of like the root of their issues, because they, their concern is why do they need to get it right now at this age? And so that's another question. But definitely a concern of parents.
Absolutely. All right. Can you forward that? Yeah. So again, like you mentioned, you're saying it's very common, right? We want to normalize this, right? Again, I think that's what people, and I think the other thing is that most people don't realize, again, how common it is. and the fact that, the body will clear it, right? A lot of people say, again, that knowledge that you're giving them. And again, we want to protect your child from the cancers and diseases caused by the virus. And again, we would say in the practice today, obviously, and that's that key piece where you would say, all right, let's talk a little bit, and I'm happy to help you with that referral for your provider. So
Definitely.
excellent. All right, next question. Oh, we have a poll question for you all. See if you're all still here with us. And so we're going to ask, and I'm sure you all have this by now. You guys have rocked it. You guys have like 3 for 3.
I know. Yeah.
Right? So let's go for 4 for 4, everybody. So why is it important for the HPV vaccine to be administered at an early age? So yes, you guys are 4 for 4. Fantastic. So yes, you've heard me say this, I'm sure, multiple times tonight. So awesome. So yes, there is a higher HPV antibody immune response. That is the correct answer. So, I think, it's harder to convince a child to get a shot, right, than an adult. As an adult, we know why we need it, and we know that, it's important. So I think that's, definitely harder, I think, than especially an adolescent or, young little children, right? And then the HPV vaccine is not more effective when it's given with DTaP and meningococcal vaccine. They work independent of each other when they're given. And they were able to give them all at the same time. They do not obviously interact with each other. We wouldn't be doing that. So again, the correct answer is the third one. There's a higher HPV antibody immune response.
Okay. That's kind of.
We kind of gave it away, didn't we? Because you guys just had the poll. So we just, so you all can do this. So again, I guess the takeaway here that is really important is that the reason that we want to give it early, right, is not only the immune response, right, but we also want to give it before they're exposed. Because once they're exposed, right? We can't take that back. So this was a slide that I think is pretty impactful, but the point, right? They're just trying to make a point. And the point is, and this was actually the head of the ACIP used to give this talk, and not this specific one, but another one. And this was a slide that, because again, it's just impactful, right? So think of the HPV and translate this to a bike helmet, right? So when do we want to put a bike helmet on, right? This is, right, we all know this, right? Before they get on the bike, when they're riding the bike in the street, when they see the car, or after the car hits them. And again, we're just trying to make a point, but I think, right, the helmet goes on before they even get in their bike. How many times, right, despite all the eye rolls that we get when we encourage them to do so, right, putting that helmet on before they get on the bike. So again, we want to do the same thing with the HPV vaccine. We want to put that, we want to have them have that before they're exposed. So we want to make sure that they're protected, they're fully protected.
Right. Just like any other vaccine.
Right.
Right.
Right. I think that exactly, once you, exactly. So if you're exposed to other ones, then exactly, that's where we're going to be. So again, this was talking about, it's hard, again, I apologize that the top is covered, but again, looking at, making, strong recommendations, right? So they strongly recommended is in the kind of teal color. It was recommended, but maybe not as strongly, is in the purple, and then made no recommendation at all is in the gray. And then, it's amazing to me that there's actually a part here that says recommended against. And I remember when I first looked at this slide, I was a little surprised by that, actually. So thankfully, that's very minuscule when we look at the numbers on this and percentages. And so majority, right, of pediatric and family providers, again, are recommending the HPV vaccine. And I think that has really changed, and I think we need to continue, again on this. But again, these strong recommendations, like Jamie said, and I think you made another great point, Jamie, when you said, they hear this from their provider, but they're coming into a totally different environment, right? They're going to see the dentist. And now again, it's in that moment of checking their mouth. So I think there's like this instant connection, right? So you're checking them, you're talking about oropharyngeal cancer, you're talking about the risks, and you're educating them like you all do when you're in your work. And now I think, like you said, Jamie, it's a perfect segue. It's perfect, right? You're asking them about exactly the risk factors in oropharyngeal cancers. And then again, talking about, the HPV vaccine. And so having that strong recommendation from all of you, I think it's critical. The more times, like you said, Jamie, that they're exposed to the conversations, the more educated they get, and the more, chances are that they're going to say yes.
It occurred to me, I have a question actually for you, Jessica. How long has the majority of healthcare providers been recommending it for males? Because I know not it hasn't been available for males as long as females. I mean, is that like a last couple of years or last 5 years we've been really recommending it for males? Because I've had
No, it's been longer than that. I'm trying to remember now. I used to know this right off the top of my head, and I know. So when the HPV vaccine was first introduced, it was 2006, and I want to say it was about 5 years. I want to say around 2011 when they started, equalizing that and providing it to boys. And I'm not exactly sure why that was. I think the initial thought was, again, we were really, it impacts, right? 91% of cervical cancers are HPV related. So I think natural gravitation to women with that. And then they realized, that men, as they started, tissue, again, you're looking at tissue, you're testing, right? This tissue, you're finding HPV strains in these cancers, within these cancer cells, and then realizing, oh my goodness, right? We've got to do this. Because again, we talked about herd immunity, and there is some of that, but not to the extent. And again, like you said, Jamie, the oropharyngeal cancer incidences are rising. And it's now, it's surpassed, like I said earlier, cervical cancer. So we are still seeing a rise in oropharyngeal cancers. So again, critical to get the HPV vaccine.
And men especially. And that's why, I'm asking that, because I've had parents of boys who are unaware that males can get the vaccine. I thought it was just preventing cervical cancer. So, and that's why I asked, because I wasn't knew if it was like a relatively new thing that healthcare providers were recommending. So
no, not relatively new, no. Okay. But there is still that misconception out there for sure. And that's another great piece to bring up. And again, the role that, talking about that with your young adolescent boys, right? That are coming in just as, for it's boys and girls.
Absolutely.
Yep.
Your next slide here. Oh, I think I might have gone.
Yep. So again, we've talked a little bit about this. And again, if someone says this to you and actually verbalizes just like this, I'm going to have you go forward on the slide, Jamie. And have you go to the next slide, because I think it's important to say that truly studies have shown us that getting the HPV vaccine doesn't make more kids more likely to start having sex. And you can Google this and look this up. So there was an article, I can't remember exactly when it was, but it was, so Rhode Island, I think it was Rhode Island or was Virginia. There's only a few states that have mandated HPV vaccines for schools. And so they did, which I thought was a really great idea. So they studied the kids that were mandated to have HPV. So they, again, had to have HPV to start school, and they followed these kids, and they found that just because they had the HPV did not make them more likely to be sexually active. So again, you can find the research out there about that. Again, depending on if you have this, background that you have gotten your children vaccinated or a grandchild, again, I think that goes a long way too, because if you feel confident enough that you're vaccinating your own children, then that's going to empower them, I think, even a little more to vaccinate theirs. Because, again, if you feel safe enough, you're not just recommending it, but you're also getting it for your own child.
Yeah. And I love that there's a study done on this, because then you can take the opinion piece right out of it. You're just using evidence-based practice.
Exactly. Yep. Exactly.
Good.
So we've kind of already covered this a little bit, well, we have covered this actually, and hopefully you guys all remember this. But again, so I'm going to go to the next slide. So again, 2 doses, right, up until the 15th birthday. And then 15 and older, they get 3. And I have to tell you, sometimes it's really good to have that conversation, because if the adolescent hears that, they're like, oh, I don't want 3 shots. If I only need 2, like, that's perfect. I mean, I don't want to get 3, and then the parent will say, oh, okay, well, we'll do it now. So they only have to get 2. So I do think that that's a good conversation to have, again, this age range, they really are quite adverse to getting shots.
Yeah.
The safety piece, again, I'm concerned about the vaccine. I read things online. I do think that, again, the internet, people, as we all know, read what's online on their phones, and, it's on their phone. It's on the internet. It must be true, right? So, this is something that, we all, have patients say to us now and again. So I think, again, if you can forward the slide, Jamie. Think that, if you'll remember, there was a slide that I showed you all that talked about where you could go on the CDC website and they have an entire component on just the safety piece. So sometimes, I've had people actually print off some of the articles, like for those parents that really want to take the deep dive and be able to actually have those like tucked away. They have them out. Oh, Jamie, see, there you go.
I was like, I will print you out a study right now to PubMed and just
perfect. So again, like Jamie said, so you can have them in a back, doesn't have to be out on your desk or, not desk, but, out on your, in your area, but it can be handy, right? Because, for those parents that do want to take that deep dive, it's great to have that research or even, a pamphlet, like again, and we're going to give you all these resources. We're going to show you, we have some at the end. And again, where they can go and find out more information as well.
You want to play that video? We can just go.
Sure.
We're kind of crunching on time here.
Yeah, that's what I'm thinking. We can, yep. And then, so I think this is something that I have heard and I've had questions when I present on this. And the answer is actually, I love the way that they have this phrased in here. And this is how I have used it. So this is something that, and I don't know, again, it's out on the internet or it could be wherever, and parents will ask you about it. Does the HPV cause fertility problems? I've heard it. I've heard that it does. I read it somewhere. Jamie, has anybody ever mentioned that to you in practice or no?
Nope, actually not.
Okay.
Not about fertility.
Okay, so if you go to the next slide, this is a really good response. And this is because there's no evidence right now, right? That tells us, that's okay, that tells us that the HPV vaccine causes any type of fertility issues. However, remember all the cervical dysplasias that we just talked about, right? And the changes to the cervix that the HPV vaccination can cause. So again, you're getting an abnormal pap back. You're going to have to go in, right, for a procedure. And they're going to, take some cells. They're going to send those off for biopsy. So I think, that having those procedures over time and the impact on the cervix, again, having these precancers or cancer that can require treatment, that will certainly impact their ability to have children. Mm-hmm. I think that's a really good way to turn it around. It's actually, you're more at risk for infertility problems by not getting the HPV vaccine, really, is how to frame it.
Yep, I love that.
So we only want vaccines needed for school. We're going to do a few more questions, and then I think we're going to actually just open it up to questions, I think.
There's a few questions in the chat, so I think that's a good idea.
It's okay. So why don't we do one more, maybe? We'll do this one since you have it up, and then we'll go to the questions in the chat. How's that sound?
Great.
So we only want the vaccines needed for school. Now, you may hear that. And again, this is a great response. So school entry requirements, right, don't necessarily reflect the current clinical guidelines that are out there, right? The research, the science, the recommendations that are out there that clinicians follow may not always line up exactly with school entry requirements. So that's a good response, right? That we can use to kind of combat that question. So again, it can be given all together. Again, we can start earlier at 9, because again, like I said before, we're seeing that, having a child go in needing 5 now, right, with the COVID vaccine, a possibility of 5 vaccines, the likelihood that they're going to get all 5, I could say, is going to be pretty low. So then they'll say, well, you know what? I only want the ones they have for school. Flu's, a little way off. We can get that later. I do want them to get the COVID vaccine. We're just going to hold on HPV. Because again, it's not required. So I think starting it earlier, when they're coming in, they don't have any other shots, right? You have this conversation with them, the chances of them getting finished, right? Even before they come in for that 11 to 12-year-old visit and have to get meningococcal DTaP, you're all done. You've already done the HPV vaccination. And again, like we said there, we know that their immune response is better. So
yeah, great.
Okay, so I'm going to answer some of the questions here in the chat. So this is great. So it looks like the first one, Dorinda asked, how do we reach the parents of the students in our program who are utilizing only the school screening fluoride for 100% of their dental preventative care up to 6th grade in our target population for vaccine? That is an awesome question. That's an awesome question. And I think, and Jamie, you can kind of back me up a little bit on this or give me your thoughts, but I think that doing some kind of campaign. So again, I think, that's an opportunity to educate. And again, it doesn't have to be just on the HPV vaccine. You could do, again, a whole, and actually I think the CDC actually has a really nice sheet that has all the vaccines on it and explains like what they cover and what they do. So that would be a great thing, right? You could even send something like that home. So I think, thinking outside the box a little bit on how you could use your role to educate, and really let them know that this is out here and this is what they need. So Jamie, I'm going to go to you on that. What are your thoughts on that?
Yeah, I think that's an excellent idea. I've never been in the schools working, but I can see the concern of trying to reach the parents. I like your idea of sending something home.
Mhm.
I'm not sure how
yeah.
we reach.
Well, you know what else I think I would recommend is that you collaborate with a school nurse. You know what I'm saying? This is a great place for interprofessional collaboration. And,
great idea.
Right? They'll love the fact that you're thinking about this, and maybe together you guys can come up with something, right, that you both like. And, it could be sent home with students. It could be, maybe that's, something you give them, at your clinics, but really maybe working together on that to be able to, come up with this targeted approach to kind of spread the word about HPV. And again, you can tie them into the other adolescent vaccines as well. Or you can send them, there's again, great infographics out there. You can send them something specific about HPV, and maybe something about, your child, came in and had their, dental preventive care, and I did an oral cancer screening, and hey, did you know that, HPV vaccination, HPV can cause oropharyngeal cancers, and you can protect your child from this cancer by getting HPV vaccination. So again, there's different things and tools out there that you can use. You certainly don't have to invent the wheel, but that would be my response to that. Anything else to add, Jamie, or would you?
No, I think that's a great idea.
Okay, great.
Is there a site where we can access free pamphlets? So the HPV Roundtable, that's where you need to print out. Actually, Team Maureen will send you resources, and I will put that on the website, and I think we can send it out via email. They will send you the RX pads and some infographics. If you want the poster and the conversation facilitator, and there's other resources on the HPV Roundtable that you'll have to print out yourself. But we'll be sending you all of that, as well as on the main dental hygiene website as well.
Yeah, so I agree. The HPV vaccination roundtable is phenomenal. Lots of good information. The CDC, and all you have to do is I believe it's cdc.gov/HPV. And again, we're going to give you this at the end of this. You'll see there's some resource slides, and we can actually pull those and send those to maybe independently too. I think that would be really nice to send down the email. So we'll kind of put a little piece together for all of you. And I would just encourage you to just spend some time on there. And again, there's infographics, the American Cancer Society, again, another fabulous resource, great colorful infographics. So there's really a lot of great resources that we will send along to you all. So there's a question about the efficacy of the vaccine. And so what we're finding, let me see what I have in my notes. So I think, there's been, what I could find, there's been 120 million doses given of the vaccine since 2016. And again, an 86%, like we talked about, decrease, in the prevalence in females. So it looks like the efficacy, Becky was helping me a little bit with that, is close to 100%. So really amazing.
Great. And then it's just is the Gardasil what's on the market?
Actually, there's another one, isn't there? I'm sorry, there's another question to that. How many different types of the HPV vaccines are there? So I believe, and I don't want to misspeak, I'm not 100% sure, but I believe that there's only one company that makes Gardasil. That's, again, I'm not 100% on that. We can, Becky, maybe we can write that down and we can send that out in the email, because again, I want to be 100% when I answer your questions. But I believe that there's just one.
Let's see in the next one.
Can the dentist get the vaccine?
I know in one state, I think we were just talking about this, Minnesota, that dental hygienists can administer it. I would have to speak to actually Lorraine, our legislative chair, to see if dentists can give it in Maine. I don't know of any dentist who gives it in Maine, but I know a lot of states dentists can give it. I'm not sure about Maine, but I could get back to you. I could ask.
Yeah, we'll definitely can write that down.
I question, though.
It is a
Definitely.
great
I
question.
mean, how convenient would it be? Right?
Yeah, I don't believe, again, I don't want to misspeak.
I don't think so,
I
but
don't think so. I think if you go to, your board, the license board, the board, the dental board, in the scope of practice in the main, and Google that, you should be able to see in there as well what your scope of practice is and if they're able to give it. But we'll definitely do a little research and send that out, and so that you all don't have to see that. So, but I don't believe that they do. And again, they do the referral to the PCP. Yes. Exactly. Can HPV be transmitted via kissing or mainly oral sex? So I don't know the statistics on this. Typically the modes of transmission are vaginal, anal, or oral sex. Those are the ones that are highly the way that's transmitted. I remember reading some studies where I know that they were kind of looking at this a little bit. I think that again, I would probably have to look at the most recent research, to be quite honest with you. I haven't been asked that question for a long time. I know that I was asked it maybe 3 or 4 years ago. And so I will look that one up, because honestly, I would want to give you the most recent studies on that and be able to go there. But again, the mucosa of the mouth, right? And we think of the fact that, you have HPV, right? We've been talking about this for the past couple hours together. And so, I'm trying to remember when I looked at that, and I thought that there was, maybe they thought of, some ways that might, but again, there's the component that for whatever reason, the men hold on to the HPV, in the mouth more than women do. So again, but I will, we'll look up the most.
I'll write down the questions, for Angela and for Amy, and we can privately email them.
Yep, perfect. So my husband does not remember if he was vaccinated or not, mostly not. Can he be tested for HPV exposure and or be vaccinated at 34 years old? Great question. So there isn't a test for men for HPV. And so, there's really no way to test to see if he's been exposed to HPV. And again, vaccinated at 34 years old, again, I would encourage him to have a conversation with his clinical provider to talk about risk and really get into that conversation. So, depending on number of sexual partners, there's a whole risk, analogy and conversation that needs to go with that. So I would recommend that he definitely has that conversation with his provider. Can a child get a booster shot for 9-valent if they've had the bivalent vaccine? Right now, they're not showing that you need to do that. So even if you got the 2-valent and then got the 4 and then the 9, they're not saying that you need to go back and have any type of booster at this time.
That's a good question. I didn't know that.
Yep. Yep.
Think about that.
Yep.
And great. Dorinda is building strong relationships with her nurses. That's awesome.
That's awesome. Yeah, it's a great idea.
I think that was it for questions, and we're right on time.
2 minutes of. We couldn't have planned that any better. So, it's been wonderful to see you all stay with us this whole time. We still have 94 people with us, and you've been here with us for the past couple hours. So, again, we will send out all kinds of resources. We will answer, some of those questions. We had, I think, just a couple that we'll follow up with on. And, feel free before you leave, if you think of any other questions, to put them in the chat, because we will put together, what I like to do if we have some questions that maybe we didn't have time to answer, even though we did most of them here, is we do a question and answer document, and we just send that out, when we send out the slides.
Put my email in the box too.
Perfect. Yep. Jamie's email's there. She can get in touch with me.
Questions?
Yep. Becky can put in maybe her email and my email. And so, I'll start closing, then maybe you, Jamie, and then Becky, you can wrap us up. So I'd just like to thank you all so much for being here tonight. I hope that you feel, again, that you've learned a lot about HPV, not only about HPV itself, but how to have those conversations and feel empowered. And again, we're going to send you some great resources so that you can continue learning and practicing and so that you feel comfortable, really, promoting the HPV vaccine. So thank you all for being here tonight. Really appreciate it. Have a great rest of your night. Jamie?
Thanks, Jessica. It's always a pleasure to present with you. I really feel that it's long overdue for the dental community to have this building these relationships with the other healthcare, populations and providers. So I hope that all of you have gained some information. as well as ways to integrate that and apply that to your own practice. So again, if you have any questions, just reach out to one of us and we'll be happy to get back to you on that.